Hello, my name is Carolyn Hardy and I am one of a team of upper GI and hepatobiliary cancer nurse specialists working across South Tyneside and Sunderland NHS Foundation Trust. When you get a diagnosis, a team of doctors, nurses and other specialists with your input will work together to plan your treatment, but you will usually have one main cancer doctor. Before you go to any appointments, it can help to prepare any questions that you would like answered. For example, you may find it helpful to take notes during these appointments that you can then read later on. You could ask your healthcare team for a copy of any letters, and this will have details of your discussions. And try to take somebody with you to your hospital appointments, such as a relative or a friend. They can also make notes, ask questions for you, and generally help you feel more supported. When talking with healthcare staff, be honest and factual when describing your problems. Do not say that your symptoms are better than they are. Talk about how you feel, including feelings of anxiety or depression. Even if your healthcare team cannot help you, they should refer you to somebody who can help. And if you need an interpreter, this will be provided. Use your own language, ask for simpler explanations, and if you're embarrassed, make sure you say so. Make sure you understand by repeating things back to the doctor, and always remember you will have other chances to ask questions. When you have tests and investigations, your medical team will use different tests and scans to see what stage your cancer is at. Waiting for test results can be a worrying time. You may find it helpful to talk to somebody about how you are feeling. Remember to ask for clarification if you do not understand. Finding out that you have a cancer can be a shock, even if you already suspected it. Being diagnosed can still cause different fears and emotions, and there is no right or wrong way to feel. After you have been diagnosed, your cancer doctor or CNS will usually want to do further tests to learn more about the cancer. This will include tests to find out the stage and the grade of the cancer. Knowing the stage and the grade helps your doctors to decide on the best treatment for you. When we talk about the stage of a cancer, we mean the size and whether it has spread from where it began or where it started. You may need a few scans and tests to find out the stage, and these can take 1 to 3 weeks to complete. Your cancer doctor will be able to tell you more. The grade of a cancer is what the cancer cells look like as compared to normal cells. Your doctors will look at the cancer cells under a microscope to find out the grade of the cancer. The grade gives us an idea of how quickly the cancer may grow. We use the TNM staging system. TNM stands for tumour, node and metastases. T describes the size of the tumour. N describes whether the cancer has spread to the lymph nodes. And M describes whether the cancer has spread to another part of the body, known as metastatic or secondary cancer. You will be informed of staging of your disease. Remember to ask questions if you have them. At South Tyneside and Sunderland NHS Foundation Trust, treatment options may include surgery, radiological intervention, chemotherapy, radiotherapy, targeted therapy or immunotherapy, or perhaps a combination of treatments. There is further information on all these treatment modalities on the website. When it comes to treatment, a team of healthcare professionals will work with you to plan the treatment that is best for you. It is good to think about the possible benefits and disadvantages of cancer treatment to help you make the right decision for you. Your doctors will not be able to give you any treatment until you have given your consent. You will usually need to sign a form to say that you agree. If the cancer has spread, you may only have treatment to control your symptoms. You will usually see doctors or nurses who specialise in symptom control, palliative or supportive care. However, if you are having problems with symptoms, you can see a member of the palliative care team at any time during your treatment. At the end of your treatment, your cancer team will talk to you about what to expect and what your follow-up is likely to involve. After cancer treatment, you will have a follow-up care plan from your healthcare team and CNS to make sure that everything is going well and to identify if you have any concerns. After cancer treatment, you may find that you need time to regain and rebuild your physical and emotional health. We have advice to help you with your recovery. A healthy lifestyle can help your body recover after treatment. It can also help reduce the risk of other illnesses, such as heart disease, diabetes and stroke. Late effects are side effects that we refer to that do not go away after cancer treatment. They can also be side effects that do not happen until months or even years after treatment, and you will be supported with these. Worrying about cancer coming back is a very common problem, and it's to be expected. Ask your doctor or nurse if there are any symptoms you should look out for after treatment finishes. If you have any questions, please do not hesitate to get in contact with one of your specialists. Thank you.